Crazy, crazy times.
Still only one comment.
And we are live, just so everybody knows.
Tom, before we start, I know we're live already. We only have one more. Did you want me to put Hugh in as a panelist, or did you want me to keep him as a...
It could be helpful for the FEMA if people start talking about that. What do you think,
Okay,
Tom?
great. Okay, great. All right.
Did you hear that, Charlie? Can't hear you, Charlie. Can we...
Sorry, Noelle was calling me.
Tom, did you want me to upgrade Hugh to the panelist?
Yeah. Yes.
So warm. My God. I was like, geez.
Hey, Jackie. I know you can't hear us. I mean, I know you can't talk.
Hello?
Hi, Jane.
Can you see me?
Your video is not currently on.
We'll start video. What is it? How about that?
Perfect.
It's on now. Hello all.
Hi, Jane.
You can hear me, right?
Yep.
Yes.
Okay, cool.
And am I coming through okay? This is Vish.
Hey, Vish. Yeah.
So do we want to turn on, do we want to go with video for the board members? Charlie, Tom?
I'm on video.
Okay. Now I am too.
But we're the only ones board members here. I think.
You promoted me to a panelist.
Hey, Vanessa.
Oh, Vanessa's here now. With her mountain scene. She knows she's muted.
I also have a beach. I can do the beach,
Oh, yes, I see. Okay, cool.
or I can do horses.
No goats in yoga?
No. Who else is here?
Hi, Vanessa.
Oh, there you all are. Okay. Who's chairing the meeting?
Should be Michelle.
Hi, everybody.
Hi, Tom.
Michelle's having a little trouble getting in, so I just sent her the email, so see how that goes.
Yeah, Tom, just make sure it wasn't the one you just received. That one is unique to you.
Oh,
Charlie, you might want to send her the,
Yeah, let me send her the,
Hey, Charlie, it's Bob Lundy. Can you hear me?
yes, hey, Bob.
Hi. Good.
for those of you calling in, we will be starting in just a moment. So you haven't missed anything yet. Just bear with us. I know we have some callers and some people who are on the video conference line as well. So just hold on one second. We haven't started quite yet. I know we have a caller on and you can't see the screen and everybody, but we're just waiting for one more person and then we'll get going in just a few minutes. I know we have a couple callers that joined. Just want to let you know that we haven't started yet. We'll be starting in just a few minutes.
Hi, Jane?
Yes.
I just, I'm still assisting her she's having some technical difficulties, but she asked if you can just start the meeting and I'm gonna work on stuff on my end to get her in, to populate her into the meeting.
Okay. So we all ready? Noel's not coming?
I'm here.
Oh, there you are. Yay, okay. So we're calling to order our meeting at about 6:40. Shall we do the pledge? Want to stand and do the pledge? Okay, pledge allegiance.
I
Are we
pledge
ready? To the flag of the United States of
United
America.
States of America,
and
and
to the
and
republic
to the republic
stands
for which it
one
stands,
nation
one
under
nation,
God,
Indivisible.
indivisible, with
indivisible,
liberty and
with
justice
liberty and
for
justice
all.
for all.
Thank you. So I'm a little unclear. Somebody will help me with the public comments. It says here we're going to do it by email.
That's correct. And it will be done only by email. So anyone who would like to make a public comment, they can send the email to communications@bchd.org and identify the particular item on the agenda that you're commenting to. And then those will be read into the record when that particular item is raised. But it is important to go ahead and send them in. That is authorized to do public comment by email because the governor issued an emergency order in the context of the COVID-19 emergency to authorize it under the Brown Act.
So, and it's my understanding that we're only taking public comments on the agenda items, correct?
That is correct because it is a special meeting, not a regular meeting.
Okay, so that's so if the public wants to send in a comment, it will be on those items on the agenda. So I guess we aren't going to do that quite yet, so we can go ahead with the information update from Tom.
Great. Thank you, everybody. Good to see you. Haven't seen some of you in a little while. And so we have not had a public meeting regarding COVID-19, and we wanted to provide an update regarding all that we've been doing here since March. And so wanted to, we have a presentation that we'd like to walk you through. Let me just adjust my screen for a moment. So this is obviously a photo of the testing site, and that's one thing that we'll be talking about. And what we're going to do is just talk a little bit about what's been happening with the state of COVID-19, give you a sense of what our district operations center has looked like over the last month and a half. And so with that, I'd like to have Carrie Ann and Dr. Kim walk us through the next couple of slides, and then I'll be back in a moment.
Jacqueline's actually going to support Dr. Kim on this part,
Great.
so go ahead,
Okay.
Jacqueline.
Sure, so I'll kick it off. Good evening. I just wanted to let you guys know about the dashboard that we've created that's available at bchd.org/COVID numbers. We've been tracking really closely the numbers that we see with the county every day, but also think that it's important to track the regional numbers in the beach cities and our surrounding communities. You'll see this on the screen is a snapshot, a screenshot of something that we're a part of our dashboard, the numbers at a glance, updated from today. In the county, we have over 28,000 cases and reporting 1,367 deaths. We also have the breakdown of cases by city as well as the number of deaths. While we're seeing a flattening of the cases, we also know from the county that we're not out of the woods yet, and currently half of the confirmed cases as well as half of the confirmed deaths in California are coming from Los Angeles County. And COVID-19 remains the leading cause of death among LA County residents. Next slide, please.
Jacqueline, just a
Yeah.
quick question.
Yeah.
Do you have any visibility into what percentage of those cases are from institutions, so nursing homes, for instance?
Yeah, a very large number of those. They're tracking pretty daily on, and I think the report today was that 50% of the deaths are happening in those congregate living facilities, really concentrating those efforts at the county level on those outbreaks in those skilled nursing, congregate living, vulnerable population settings. So you're right to bring that up. There's a large number of those in those settings.
So, but locally, are our numbers in the South Bay related to nursing homes? Do we
Our
know that?
numbers, the county does report by institution with outbreaks of 3 or more. The Kensington, I believe, is on there, but there are no outbreaks at at either the Sunrise facility or Silverado facility. There are some more regionally in Torrance, I believe. So those numbers are updated every day from the institutional setting so that we are aware. I'm not off the top of my head, I don't know what the numbers are at the Kensington, but those numbers reported that do contribute to what you see on the screen.
Thanks.
Nationwide, I think the numbers are something like about a third of all the deaths are in chronic care facilities and nursing homes.
Right.
Who is moderating that they would see that I raised my hand? Because I raised my hand.
Oh, well, okay, I guess I'm in charge, but I didn't know that you raised your hand, so
Okay,
go ahead.
I just wanted to point that out so that you would know.
Yeah,
that.
just really raise your hand.
I have a friend who works at Kensington and
Hi, Charlie.
told me that there had been no new cases in the last 25 plus days at Kensington.
Wonderful.
The good news.
Yes.
So you'll see on this graph is just one of the graphs that we have on our dashboard. This tracks the local data. The cumulative beach numbers are in yellow. You see Hermosa, Manhattan, and Redondo. The beach cities have done a fairly good job of flattening those cases, but we also have Torrance on here for reference because we know that this disease really has no boundaries, and so it's really important to look at things at a more regional level. Also on the dashboard, when people check it out, there are numbers of cases per 100,000, so you can compare our numbers with the county. And so I think that, having and being able to trend and track these data points are really important as we look into recovery. And it also has numbers about testing and case fatality. So we just wanted to draw your attention that we are tracking this data and wanted to kick it off to Dr. Kim if he has any updates about what's happening on the ground from the medical perspective.
Jacqueline, before Dr. Kim, I saw this chart last night at the Redondo Beach City Council meeting. I was also surprised at the Torrance curve. What do you think is different between the 3 beach cities and Torrance to lead to such a different curve?
Yeah, I think
Jacqueline, sorry, before you go on, just Dr. Bolad is on the line now.
Good. She can take over.
She's calling him from phone, Jane.
So she still wants me to. Okay, fine. Got it.
Yeah, so welcome, Dr. Bolad. And to answer Vish's question, I mean, I think that's a good question. I think that it's really important, and I don't know that I have an answer, but I think that it's important to kind of check these regional data. Obviously, our cities are much smaller than Torrance's. That's why it's kind of important to see what's happening on a more regional level, as well as tracking and trending what's happening on the county level. I think that you'll also see from the data that the rich data that we're able to get from the county, that a lot of this data is showing a lot of inequities across the county in terms of who's able to get tested and where these cases are showing up in terms of affluence and among race as well. So some of those discrepancies you see, I think that we'll just continue to track and trend the local things that are happening at the beach cities as well as what's happening in the county. And if there are suggestions of the ways that you want to parse out the data that's going to be helpful as we move forward, then we're really happy to provide that.
Vanessa, you had something? Did you want information out there?
I was just asking if these are numbers that are available on our website, and where on the website are they available so the public can access them?
Yes, thank you. They are available on our website. It's bchd.org/COVID numbers. It's also on our coronavirus main page. These are updated every day when the numbers come out from the county. They also have numbers of how many people have been tested. And so those numbers are updated every day, and that populates to update this dashboard. And I'll kick it off to Dr. Kim now.
Yeah, I just wanted to say a couple words about our local hospital systems. As you know, we have Providence, which is a stellar system, and they report their numbers from both San Pedro Peninsula as well as Torrance Memorial. I think they had their peak back in early April, where the combined census for COVID patients was about 80. And we've seen that come down a little bit. And so now in this first week in May, it's in the mid 40s. Torrance had a similar peak earlier on. And at the end of April, they dropped down to about 38. And for some reason, we bounced up to 50 as of 2 days ago. So we've seen a little bump in Torrance. Both hospitals are well positioned for a surge should we get it. And they have plenty of PPI there, or PPE. So we're all set there. In fact, both hospitals have trained all their staff to use the appropriate N95s and face shields when they're around COVID patients. And I think everybody's happy with that. So we're fortunate to have two wonderful systems that are well positioned for this pandemic. And then, you know, Jacqueline and I and Tom have been looking at testing for quite a bit. And, you know, Beach Cities is doing a tremendous job with testing. But we continue to look at other platforms. And so we'll continue to do that moving forward. It would really be nice in my, my wish list is to have a point of service test that can do IgG and IgM antibodies that has great specificity and sensitivity, but it's not out there yet. So we're still doing the PCR testing and then backing up with serologic tests. We have two good serologic tests. We're not doing that, but local physicians can in the hospitals. There's the Roush system as well as the Abbott system have fantastic sensitivities and specificities. And I'll kick it back to Jacqueline and Tom.
Jacqueline, one of the reasons Torrance might be different is because they do have more nursing homes, I think, that are involved than we have had. They have several, like maybe 3 or 4. Or at least.
Yeah, that's a great point.
Okay, so here's our team. We want to talk a little bit about the District Operations Center. In early March, we converted over to this center and basically took all of our resources and focused them full-time on COVID-19. And so this is in alignment with FEMA and the Federal Emergency Management Act. You see Hugh Daniels is on the line there. He's been advising us on the best way to align our resources from an emergency standpoint. And one of the first things that you do in an operations center is you identify your objectives. And so these were the objectives that we identified over a month ago. And you can see that testing was our number one objective. And we've been able to accomplish that. And we continue to be able to accomplish that. UCLA has provided expanded testing at the 514 Prospect site. We've also partnered with Los Angeles County, Little Company of Mary, and the City of Redondo Beach to operate the testing site out the Galleria, and you'll see some numbers regarding that in a moment. Another objective that we had is to identify at-risk older adults in the community, and you'll get an update on what we've been doing there. Provide healthy adults an opportunity to be of use to the community, and so these are the volunteers. In true Beach Cities fashion, the volunteers have been flooding in since this began, and so we're using them and working with them to help out in the community. Obviously doing what we do best, which is disseminate timely and accurate information. That's something that's been an objective. And then provide health and well-being tips and tools. We've been doing that and really focusing on the mental health side of things and really helping people deal with an incredibly stressful situation. And so that's something that has been a goal of ours from the beginning. And then one of the things that we've really been working on here lately is the recovery planning and what does it look like. We're now seeing some restrictions starting to be eased. We've been working on this literally for weeks and working with the cities and the county and other partners to prepare for what's beginning to happen now. And we'll talk a little bit about that. We do have some concerns, and I think that will reflect how we recommend going forward. And so with that, I'd like to turn it over to Carrie Ann at this point.
So good evening to the board and the community. Carrie Ann Lawson, Chief Programs Officer. When we converted over to the District Operations Center, one of the first things we did was take our information in the referral line to a 7-day-a-week operation. And so you can call the information and referral line 7 days a week, 8:30 to 5 for assistance. For those of you who can see the screen, that's our team there who will answer your call. And we've been working really hard to help people who need assistance with errands, healthcare, benefits applications, all of those things. And for the community, you can call 310-374-3426, extension 256, 7 days a week, 8:30 to 5, and we will answer the phone. If for some reason the call volume is high, and you'll see our numbers in a second, you just need to leave a message and we'll get back to you. But we have been in this 7-day-a-week operation. You can see from the 16th of March, we've had 747 calls. One of the things we've been doing with staff has been to help our vulnerable seniors and people with underlying health conditions who were the first group told to be safer at home with errands. And so we have run 367 errands with staff and 92 errands with volunteers. This represents over $10,000 worth of food that we've helped people procure. We are able to assist people who are having who are low income or having difficulty with income with purchasing food. And to date, we've subsidized the purchase of food to the total of about $2,000. So next slide, please. We've also, as we talk in the community, and particularly as we go into this phased reopening we're talking about with recovery, it's really important that the community understands that our best community and individual defense, against COVID-19 are the basics of healthy behaviors like washing your hands frequently, not touching your eyes, nose, and mouth with your hands, really being careful to self-isolate if you are sick, to practice physical distancing by staying home, and to wear a cloth face covering when you're in contact with others from outside of your household, and in particular when you go to purchase supplies if you're doing that yourself. And again, I would say to the community, if you need to self-isolate but you're worried about getting food, you can call the hotline and we will figure that out with you and make sure that you have food. Next slide, please. So Tom mentioned the testing center, and Dr. Kim referred to this before. There are two types of tests that you're hearing talked about in the media. One is the diagnostic test that checks the samples from your respiratory system. You're seeing that with the cheek swabs or the swab up the nose. This is the type of test that is happening at the South Bay Galleria testing site. We're doing the cheek swabs. The antibody test checks your blood for antibodies to test if you've had a previous infection. And we are actually assisting this weekend with the research study partnership between USC and Los Angeles County, and will be, it's invitation only. So I don't want the community to get excited. You can't show up and be tested for this at this site, but we are doing that here in the South Bay. So, I think it's important as the county goes into these efforts for research that we make sure the South Bay is represented. So next, please. So we're really proud at our testing site at the South Bay Galleria. We've done 9,230 tests. We are getting somewhere between 350 and 500 folks a day. And we really do have the capacity for 500 tests a day, and we prefer to be busy. It's a lot more fun when there's a steady stream. And honestly, on National Nurses Day, could not be more proud and having more fun with the nurses from Providence who have been out there every day helping us. They really are a fantastic crew, and we're really lucky to have them. The other thing we did, very early in this process, we needed to close both the Center for Health and Fitness and Adventureplex. Obviously, with the schools closed, we're not delivering our programming in the schools. And so you can see on the screen in front of you that we've posted 135 videos across all of BCHD's programs since March 16th. And have had almost 28,000 views. So we're getting great feedback, and we're really proud of the community for staying dedicated to their fitness regime and practicing with the physical trainers, personal trainers rather, and doing meditation with us. And you'll see some of this virtual programming grow across this month as we work through the mental health awareness campaigns. Next, please. And then finally, for my section, we are communicating with the community and in fact, perhaps over communicating, because we want everybody to have access to high quality, accurate information, and the information changes every day and sometimes hour by hour. So you can see on the left of the screen here, those are examples of our newsletters. Those go out weekly. We have all of the information and all of the guidance updated on our website, bchd.org/coronavirus. And then we're pushing all of the same information out through our social media channels. So lots of ways to partner with the community, really also offering our materials to the cities for their communication channels and working with our local papers. It's really important that folks have this access to the high quality information. And with that, I'll turn it back to Tom to talk about recovery.
Tom, before you get into recovery, a question around messaging. So one of the messages that we're sending out is self-isolate if you're sick. But then sort of the message that goes with that also is that you're only, able to spread if you're sick, which I think there's a lot of confusion amongst people whether, people who are asymptomatic can spread. And so I think the science is pretty clear, asymptomatic people spread, but the general population, a lot of times public says, well, if I'm not sick, then I don't need to mask or I don't need to social distance. So is there a way we can refine that message to be a little bit more clear that we don't leave out asymptomatic spread? So that's my first concern. And then the second one is around masks. It's been quite a long time since the CDC finally got around to figuring out that masks actually do help stop the spread. But I was hoping that there's some sophistication on understanding the difference between a thin gauze face covering versus more substantial materials that have some filtration ability. Is that something that we should maybe take leadership on in our community to help people understand the, filtration and how not every piece of material is exactly the same? And I would appreciate if any of the medical experts on this, on the board or on the executive team would comment.
So I can answer to what we are doing. In answer to your first question, Vish, and these are excellent questions. The only way somebody who is asymptomatic can control asymptomatic spread is by wearing a cloth face covering when they're out and about, and by endeavoring to not be out and about very much and to really only go out when it's absolutely necessary. And so I think as we proceed and more business opens up and we have more opportunities to go outside, it will be imperative that people practice that behavior of wearing the cloth face covering. And then as to the masks, just so you know, yesterday, I believe, our guidance on masks went out via social media. We are following the handouts from the CDC and continuing to promote that guidance around type of face covering, but also really helping the community understand that we still need to preserve the surgical masks and the KN95s that you hear about for our medical professionals, and that those of us who are simply going to the grocery store or are going to be in a park where we might run into a group of pass people on the sidewalk, we need to be using a cloth face covering. And to your point, Vish, it's not a thin gauzy thing, but it also one where you have at least 2 layers of t-shirt material or slightly thicker. And it's important to realize also, I do just want to say, we're encouraging folks to exercise alone, so that you don't require a face covering, because as it gets hotter, it's very dangerous to do extreme physical exertion in a face covering and restrict your ability to breathe. And so if you're going to do that kind of a workout, you should not wear a face covering, but you also shouldn't be with other people so that it's safe. So, and then if anyone else has any comments from our medical professionals.
Well,
I had another question. Oh, go ahead.
Well, I was just going to say, my comment is that, the thing that people don't understand is that the whole project was to decrease to flatten the curve. It wasn't to decrease the area under the curve. So, you know, in the absence of an effective vaccine, basically the assumption is that a very substantial percentage of the population is going to get this disease. And until we have effective treatment or we have a vaccine, you know, people, especially people that are high risk groups like elderly people or people with significant comorbidities, you know, a lot of those people are going to die. And so the thing about it is that realistically, an effective vaccine, if they're able to come up with one, which they've never developed for a COVID virus before, it's really going to be the better part of a year to 2 years before they have one. In the meantime, I think that the strategy is to try and come up with effective modalities of treatment that will decrease the severity of the disease and help ameliorate some of the mortality. But the strategy is that, you know, half the population or more are going to get this disease over the course of time. It's just the idea is not to try and have them all get it in a short period of time and overwhelm the health system. But the area under the curve is the same, whether it's tall or stretched out. So, I mean, especially for people that are in high risk groups, they're probably going to look toward an extended period of social isolation and distancing. And for the rest of the population, I mean, there's no way you can shut down the economy for 2 years. I mean, people are going to run out of food. You know, they're going to be on the street. I mean, people don't have 2 years worth of money. So, I mean, the majority of the economy and the majority of other people are going to go back to work and go back to school, and things are going to reopen. And I think the federal government gets a lot of crap for the way they've handled this thing. But really, you know, the thing about it is that when it comes to reopening, the situation in Cheyenne, Wyoming is very different than the situation in Los Angeles, California. And the proper forum for making those sorts of decisions, because these are life and death decisions, is going to be at the most local level possible. Ideally, you know, your state and county and your city making these decisions as opposed to the federal government, because the circumstances are wildly different in different parts of the country. So, I mean, I think that that people have to understand that in long term, that's really the strategy, you know, is that we're not really going to necessarily decrease the area under the curve. It's just we're flattening it down so that the system doesn't become overwhelmed.
I had a question and a comment. First, I'm really glad that we're using the term physical distancing instead of social distancing, and that it really hopefully can help people make that difference between actually staying physically apart, but that there are still ways that we can socially connect with each other, and that we should continue to do so. So I'm really glad in terms of the language that we're doing that, and wanted to let you know that I noticed. Who gets the email newsletter, and how do they get on that list?
Kristen, would you like to?
This is Kristen. Yeah, Kristen Higa, Chief Communications Officer. There are a few ways that residents can sign up for our email list. One is through our website at bchd.org. If they go on there, there is an e-newsletter sign up. It's right on top of the COVID-19 page as well, so we moved it in a few places. If they can't access that, they can call into our 256 phone line, or they can also send us an email at communications@bchd.org. I also recommend that people follow us on social media. They can find us on Twitter, Instagram, Facebook, LinkedIn at Beach Cities Health. And our email list is roughly 30,000 people. That does include Torrance and some AdventurePlex families as well outside the area.
Okay. And the other thing I'd like to encourage everyone to do is I'm not on all of those social medias that you mentioned, but I am on Facebook, and I try as much as I can to share publicly all of the Beach Cities Health District materials, because first of all, they're excellent, excellent materials. And I want to provide as many people with the opportunity to see them and then to connect back and get on those lists so that they can get those things directly. And the more we can share those things through the social media, the more people we can get on that email list so that we are contacting as many people in our community as possible with this excellent information that our staff has really gone all out. It's great stuff. Thank you.
Great. Are there other comments or questions? Or I can move in and discuss a little bit about the recovery plan. It is on our website, bchd.org. It's a living, breathing document where
Did Tom freeze?
Yeah,
Ah!
we're not hearing Tom. Charlie.
Carrie Ann, why don't you go ahead and take the recovery slide?
Back? Can you all hear me or?
Now we can.
Okay. It was really good what I just said
Yeah.
too. I'll try to repeat that. But so we've been working on this recovery plan. We've been working with our partners, with the cities and the chambers. We just are in the process of sending out a survey so that we can get input from the businesses about things that they can do to improve things for their customers as well as their employees. And I think it really gets to this point here, which is the power of community, and that this is really up to us. And I've been involved in a few incidents, whether it was fires or H1N1 or the Olympics right after 9/11 in Utah. And I've never been part of an incident where we can control the outcome. You can do that with fires sometimes if you clear brush away from your house and that sort of thing. But we've never been in a situation that I've been part of where we can control the outcome. And so that's something that the health district does very well. We've shown how you can change health outcomes, whether it's childhood obesity or whether it's drug and alcohol use. You can do that as a community. And so we're pushing that message very strong, and it really is up to us. And so we want people, whether it's businesses, we want them to engage and tell us what are they willing to do, not what are the cities or the counties going to let them do or not do. And so we're out there getting that feedback and input from the sectors like the business community. So what we're saying is, as Carrie Ann has been saying, is as we move into these next phases here is that continue to do your part. If you can, stay at home as much as possible and practice physical distancing so that we can keep our most vulnerable populations in the community safe. That's going to be extremely important moving forward. There are 6 indicators that the governor has laid out that we're going to guide the recovery planning. We use those as we created our recovery plan. And so our recovery plan contemplates moving from the urgent phase, which we are in now, to more of a stabilization phase. In order to do that, we were suggesting that there be sustained reduction in cases for at least 14 days. So as you've seen from the data that we showed you, that's not happening. It's leveling, but it's not reducing. Widespread testing and contact tracing, not where we would like it to be. Ability of our healthcare system to handle surges. We just heard from Dr. Kim that in the South Bay, yes, that has improved. We are seeing some promising data that you'll see on our dashboard, where the number of positive tests or infections at the Galleria, that's the most local information we have. We're seeing that number. It was around 5%. It's now dipped down to about 2.5%. So that's very encouraging. But we anticipate, I think as Noel was just talking about, we anticipate a surge. We think there's likely going to be a second surge of some sort here. And so we're really urging people to use the other tools that Carrie Ann was talking about. We we think that that's going to be needed here. So we think our recovery plan is going to need to be updated to reflect this issue of a likely surge. And so we are talking with people about that. That's affecting our plans for reopening as it relates to some of our facilities. We don't anticipate going back into our offices, obviously, until it's allowed by the county and their plans. And we'll talk a little bit about what the county is saying as far as their plans. We got that hot off the presses today, but we're not anticipating going back in for a while. And so this is what the county is saying. Safeguards in place before opening, ensure the capacity, protecting vulnerable populations, developing protocols to keep workers and residents safe, ensuring public health capacity to test, trace, and isolate. So those are going to be the tools that the county is going to be recommending. This is the process for the staged reopening that the county is proceeding with. Review and evaluate efforts to slow spread, engage sector leaders to plan for recovery. So that's obviously something that we're doing with the business sector through our survey. Develop protocols for reopening, reopen sectors by stage. So as it relates to our operations at the district, we're following all of these recommendations, and we're urging the businesses and the cities to do the same as they consider reopening. And in the case of the district, we're going to continue to operate in a virtual environment for a while here. We anticipate it being at least 4 to 6 weeks, if not longer. We'll start to, phase back in based upon what the county is advising us, but in light of the fact that we do think there's going to be a reoccurrence of this virus, we're going to move very slowly to reopen our offices and our facilities is our recommendation.
Tom, I have a question about the tracing.
Yes.
Are we going to be involved in that at all, or is that all the county?
Right now, that's my understanding, and maybe Carrie Ann can weigh in, but my understanding is that's coming from the state, and that the state is doing that through the county.
County is doing that, and I had that question as well. And I think that if we have staff that's available, that's able and willing to assist the county in doing that, I have a friend, that's what he's doing all day long, is he's calling and talking to people and trying to trace contacts.
Yeah, the state has a program that is 20 hours worth of training online. And they're looking for a lot of people.
I think that if we can get on board with getting more people to help with that and be trained with that, and either our staff or volunteers in the community or whatever, if there's a training, that's information I think is appropriate for us to be assisting with, and getting people out there doing that contact tracing, because I think that is a very key part of opening. I had another question.
Vanessa, if I may, I would just say we share your desire to be involved with that if it's possible. When the governor announced this training initiative this week, they are starting with identified and existing state workers who are being retrained in that academy. So the first 10,000 people they're looking to
fantastic
train come from state workers. And then we'll see how they fill the next 10,000. Their ultimate goal is 20,000. So Jacqueline and I continue to monitor that to see if there is a role for health districts and reaching out to ACHD to see if there's a role for health districts. But right now they're really only working with the 61 other county health departments and, like city health departments like
yeah.
So, but we are monitoring that. We'd love to participate if there's a space for us.
I think that's a fantastic and appropriate place for us to be. The other, can you go back a slide? Okay, so when we talk about protecting vulnerable populations, I am personally not a vulnerable population, but I'm connected and live with 2 people who are. So that makes me also then somebody who has to act as if I'm a vulnerable population, which means that as things start opening up, for instance, board meetings, I may not feel comfortable physically showing up at a board meeting, no matter how many masks and gloves people are wearing, for I don't know how long. So I think another part of protecting vulnerable populations is encouraging in this beautiful chart, well, this is somebody else's chart, but that we provide safe opportunities for people who are isolating to still participate in these kinds of things when other people are going there live. Like, we are gonna at some point have a live board meeting, and I'm gonna have to decide whether or not I want to attend. And I'm gonna make that decision based on the health and well-being of the people that I live with. I want to be able to do my public duty and participate. So, and then the same would be true, and then all sorts of other kinds of circumstances. That's another level of, well, how do we integrate these kinds of communications with live things if people are going back to live things where people still need to make those choices not to, so that we don't eliminate the participation of people who are vulnerable for the public and for us.
Yeah, no, I agree. I think that everyone's going to have to use their own judgment on these sorts of things because, you know, people live with their older relatives, people have friends that they visit or help support that have comorbidities. So everyone's going to have to make a judgment about these sorts of things. And I think it's really going to change a lot of the way we do business, not just for our board meetings, but like for companies and things like that can work remotely. Some people are going to be doing it for a prolonged period of time, probably.
And as part of our reopening, oh, sorry.
Tom, another point I wanted to make for, he's talking about safeguards in place before opening and our input into that is the availability of disease prevention tools, right? So masks, can people buy masks on the open market? Can people buy surface disinfectants on the open market? Can people buy hand sanitizer easily? I mean, if these things aren't available, we start to reopen, people are sort of going about and they can't get simple things that help prevent spread. So I don't know if that's a factor that we can add in or should consider, but just availability of masks, disinfectants, hand sanitizers on the market.
And those are certainly items that we're providing to our vulnerable population. So we're providing that to our 440 folks that we manage case management with. And so we're providing them face coverings and that are being made in the community. And then we are also providing them through our errands that you saw the numbers on. So we're providing that to our vulnerable populations. And it's something that we'll continue to partner with the community on. As it relates to our reopening plan at the district, obviously we'll take direction from the board, but we don't envision live board meetings for a while, certainly in the month of May and June. We don't envision having live board meetings. We envision virtual meetings, and there'll be some of those in June, maybe more than one. But I don't even know about July. We'll just have to see what happens. Barring a different direction from you all, we are going to take a little different track than some of the openings that you're seeing at the health district, because we do anticipate some sort of surge here in the next 6 to 8 weeks. So next slide. So this is the reopening process that the county has released. And so May 8th, which will be Friday, they're going to allow certain types of businesses to open. That will be florists, some retailers, car dealerships, golf courses, and trails. And so what you're going to see from Redondo Beach and Manhattan Beach, and I imagine Hermosa, we haven't heard as much from Hermosa yet, is going to be the reopening of some parks and trails. I think you're going to likely see that from Redondo Beach. At their next meeting last night, they gave direction to staff to return with opening up some parks and some trails soon. So we don't know exactly the time frame, but low risk businesses such as manufacturers, offices, retail, essential healthcare, outdoor recreation, and libraries, museums, cultural centers, and galleries will be opening up soon, is what the county is proposing. And then stage 3 will be higher risk businesses, movie theaters, bowling alleys, and K through 12 schools, colleges, and universities. And so Allie and I are sitting on what's called the Redondo think tank for Redondo School District. We had our first meeting. I lose track of time. I think it was yesterday. I think we had our first meeting yesterday. And that's going to be a weekly meeting, and that's a very engaged group. And so we are providing input and insight with that group. And then the next stage would be the highest risk businesses, such as entertainment venues, large conventions, and then sporting and spectator events is what the county is saying. So this is their plan. We literally got this today, I believe. And so we wanted to share it with you as soon as we got it.
Tom, the beaches, or the mayors have got together and they're going to do the beaches open in stages as well?
Yes, so that's part of our recovery plan. That's something that LA County Beaches and Harbors has been working on. And so they are looking at some sort of limited access where people could walk on the sand and go down to the water, but could not congregate. You could not go down in the first phase of the reopening of the beaches and sit on the beach on a towel, but that you would be able to walk on the beach and you would be able to go in the water. And not certain when that will occur. We think that'll likely be sometime next week is when that limited access will be allowed. It could be next week, or it could be early of the following week.
I think I saw Laura MD's posting. If you go to the city, they'll tell you the phase. She mentions they listed the phases like we just did. And you can get that information off of those.
And right here, what I wanted to add to the slide, ensuring equitable access to services for vulnerable populations. Excellent.
Yeah, so that, again, this is just more direction from LA County, and what we're doing and what we're pushing out is obviously consistent with what LA County is doing, and then it's also shaped to our community as well. So this is, we think, a great infographic that the county has done, and so you'll likely see similar ones from us as we push this out to our community.
Wait, you did that too soon. Can you go back? Okay.
So these are, again, as we talk about, so these are the different stages of the reopening from the governor. And so very similar to the county. So you're seeing kind of the county sort of mirror what's happening with the governor. As we've discussed, we're going to continue to take a health first approach. Again, we're going to get that message out and really urge the community to take control of this situation themselves by physical distancing, wearing face coverings, and really take a health prevention approach and a community approach, which we have done for 20 years at the Health District, and really apply that to COVID-19. And so we've been urging that all along, and it's going to be important now more than ever, really. I can't emphasize enough that we're concerned that that people may let up on great practices that they've been doing, and we're really going to be urging and pushing the message out. I think messaging will be the key here over the next 6 to 8 weeks to have the community really continue to follow these prevention recommendations that we've been making for the last couple of months. And then we're going to continue to protect the most vulnerable in our community, and that'll be a health priority of the district. So this concept of it's up to us is that we can all be health leaders. So you're going to see some marketing on that, and you're going to see a strong push from us on this concept of community health. And now more than ever, this is the time.
Sort of an interesting thing, and it's not really, but I'm noticing tons of trash. I'm noticing tons of masks. I'm noticing tons of things that people wash their hands with, and gloves. So somehow we need people also to be better about taking care of these new things they have in their lives and finding trash cans. We
agree, and we can continue to get that message out. Again, again, this is going to be the type of messaging that we're going to continue to do with our classes, our social shares. Those have been a big hit, lots of clicks in social media, wellness check-ins, MOI, bringing people together, concept of care package or meals. There's a blood drive in Hermosa Beach on May 10th. Pre-registration is required. That might be sold out. We'll be looking at other partners.
Information about that?
I'm sorry?
Can you send the board information about registering for the blood drive if it's still possible?
Yes,
What I noticed on the Red Cross website is they want AB only. And even though I think I am AB positive, I can't get anything from Kaiser that confirms that. So.
Yep, we'll provide that information, and then we'll also provide information if there are additional blood drives happening. And then neighbors helping neighbors, we're obviously here to help and provide information, but it really does come back to the community and the people that are closest to you, whether it's your family or your neighbors. And so we're going to continue to help the community understand how they can help their neighbors.
On that blood drive, I'm assuming it's going to be a standard one and not going to deal with the issue of plasma of people who've had the COVID virus.
Correct, that's my understanding. And the one in Hermosa is being led by the volunteer group. We helped put them in touch with the Red Cross, and they're coming to do that. And it's going to be sort of volunteer and community led in Hermosa. So that was something that the volunteers from Hermosa have stepped up and are running with, and we're helping them with that. And I think that, so next.
So are we on, financial? Okay.
So we wanted
Jane,
Yeah.
before we move from this item to the next agenda item, we should indicate that we're closing the public comments on this particular agenda item. And we should probably, and we should also, I'm sorry?
Hold on, I'm sorry, Bob. This is a financial forecast as it relates to COVID, so we're not quite done with this item.
Okay. Oh, that's fine. Go ahead with that. But at the end of this, we should then read into the record the emails we have with public comment on this topic before we go to the next agenda item.
Yep.
Okay.
Great.
Very good.
So in addition, what we wanted to do, as opposed to telling you and updating the community on all the things that we've been doing over the last month and a half, is we did want to provide a financial forecast update for the remainder of this fiscal year. And so Monica's going to walk us through the numbers so that you all and the community can understand where we are financially this year.
Great. Thank you. Good evening, board and community and staff, and Monica Sua, Chief Finance Officer of the district. So first, as we get started, I wanted to just remind ourselves where we were before the pandemic fiscal year to date February. So through the month of February, 8 months of the fiscal year, the district had a positive operating income of $1.5 million, which was a $200,000 positive variance to the budget on the operating level. And this originated from a variance, positive revenue variance to the budget of $126,000. While the Health and Fitness Center did have a negative variance due to canceled events and low drop-ins compared to the budget, their revenues were positive compared to prior year at this time, about $40,000. So they were running positive there, but to the budget year-to-date February, they were negative. And the positive variance in other revenues are made up of the increased portfolio earnings that we have experienced and the Sunrise Partnership income made up for that negative variance. And we ended up with $126,000 positive variance through February. So on the expense side, we also had a positive variance of $77,000, and that is made up of positive, mainly from the payroll of open positions and lagging in hiring on those, and also on the health fund, which is more of a timing variance savings that we will see later on in the presentation. But the expenses that we were over budget were mainly in other operating income, excluding payroll, that were from the juvenile diversion was a big item that we've been working on this year, and some HIPAA compliance and some other professional legal fees that we talked about before. And the other part that we were over in was in building operating expenses that came from the insurance and utilities and some engineering services. But on a net operating income level, the district had 1.5 million and had a 200,000 positive variance to the budget before the pandemic. And so then year to date, we want to add in March. And so for the month of March is when, the pandemic started about the mid-month. And so the district immediately closed the health and fitness operations around mid-March, which you can see affected the district about $100,000, which is half the income from health, or half the revenues at health and fitness centers. The other portion that dropped was the portfolio earnings. In 1 month, we had almost $100,000 drop in the portfolio earnings, and the joint ventures was a little bit behind in the month of March. And for total expenses, the overage of $27,000 is mainly due to the COVID additional expenses that we incurred, which were for ordering gloves, sanitizers, masks, and we also had to disinfect the building and some communications materials. So in the month of March, the district experienced a net operating loss of $136,000 compared to a budget of $113,000. So in 1 month, the district dropped to $250,000 to the budget. As the pandemic started, we immediately started tracking the district additional expenses that we were incurring. And so for, in March, if you want to click on the cost for labor included $297,000 for about 7,800 hours of work performed, and this includes exempt payroll as well. For about 134 people got engaged in the COVID emergency response. And so the labor cost around 297, other costs around 40,000, total of 337,000 of cost that the district would not have incurred would have been a normal shortfall of a downturn in an economy. These were added costs that the district then were incurring. So next slide. Okay, so combining these, go ahead.
Monica, are those labor costs then captured within the payroll line item?
Mm-hmm. Yes.
Okay.
But we were operating normally for about a half a month.
Yeah.
Yeah. Yeah. So, okay. Any other questions? Okay. So, as we then combine the two year-to-date February and add on the month of March, we started with a year-to-date February positive net income of $200,000 compared to the budget, and now we added the March negative variance, and then we added up year-to-date about negative $44,000. And the district still has the operating income of $1.4 million. And then from there we have projected the last 3 months of the year and kind of see how that is affected by the pandemic. And that's fine. Yeah, we can move on. And if we add that a 3-month forecast, we're going to anticipate some more of those revenue downfalls, especially obviously at the health and fitness centers that are we're going to see up to tune of $860,000 loss in revenues because of the closed facilities. And in addition to that, we'll see some, we anticipate to see some drop in our rental revenue, and then offset though by some positive property taxes that we're still anticipating to come in at normal level because that wasn't affected by the pandemic yet. And then on the expense side, the district budgeted an annual $718,000 operating profit. And as you can see, between March and June, it drops, even in the budget, we budget for that drop, and it's because at the end of the month, we pay out about $1 million in direct payments for the grants to the schools and direct health funds and other grants. The district also has been able to add another $100,000 that we'll talk about, or $125,000 in direct community grants by the end of the year. So that brings the district bottom line to a break even, about 15, but around break even that we're anticipating. And this is before we would do any FEMA reimbursements that we've been working on, where we have identified the possible reimbursable expenses. So FEMA is very strict on what we are able to get reimbursed for. So we won't be able to get reimbursed for all expenses that we're incurring, especially exempt payroll and expenses that we would have incurred otherwise, like having a van, driving the van and so on. But I have calculated that the district, these are estimated in through the end of the year, to able to submit $627,000 worth of reimbursable expenses, of which FEMA will not reimburse all of it, but are able to, or their rule is to reimburse about 75%. But that assumes that everything we have submitted would be accepted as reimbursable. And we're also working on expedited funding, and hopefully maybe 50% of the 75% might be, we'll be able to get earlier, because they are allowing for that in this pandemic. So we have submitted that as well, but we don't know yet if we're gonna get that. And so that's what we've been working on. And it has,
Monica, just a question on the grants. So you have forecast in June to pay out certain grants, but given the pandemic, does the calculus still make sense for those grants? Or does grants still make sense to deploy given the current situation?
Well, what I can say to that is that, we did contractually have grants that are already in the budget, basically for 1.5 million almost, and those are organizations that still needed, unless I have maybe Carrie Ann can chime in on that.
All I would add is
and
that
then we go ahead.
These grants are on a performance reimbursement schedule, and so when they submit their final invoices come June, they'll be submitting for what they were actually able to accomplish in the COVID-19 environment. So we may see some that aren't able to execute their contract fully. We may see others like the Salvation Army Meals on Wheels, the food pantry. I know that Cancer Support Community, who we fund, took all of their operation virtual and has continued with programming. So there may be others that are continuing to function in full. So, but we will evaluate that when they turn in their final reports for reimbursement in June.
And I would just,
one thing I don't understand is that the primary income shortfalls are Adventureplex and the Center for Health and Fitness, but those are money-losing operations. So,
well,
is there any cost cutting or cost containment being done at all in those centers?
Sure. I mean, we have cut off services as much as we can, and there are some fixed fees, but we still are employing the staff there that have been directed for other purposes, and that is actually most of the part of the 400,000 of the labor. Those are redirected resources that we have assigned to other duties at the test center or errands and hotline and things like that. And that's what the 400,000 really is about.
So just to be clear on, maybe make two comments. One on the grants. That's many of these grants are for services that have been happening already. We're suggesting actually that we think you should increase the grant amount is what we're recommending due to COVID-19. And at the end of the day, we believe that we've been able to pivot, and also thanks to the fact that you can see there we had a $718,000 operating surplus already budgeted, and at the end of the day we were able to pivot and provide all the services that you've seen, and still wind up breaking even at $15,000. That's not counting the federal reimbursement. So that's what we were shooting for, is let's pivot, let's provide the services that we can during COVID. Let's try to use our employees as best we can. Some we were not able to use, but let's use our employees that are not bringing in or working at the fitness center or Adventureplex because they're closed. Let's go ahead and pivot and have them provide other services. And so that's what we've been doing. And we think there's a good chance that we're going to get the 470,000, that we're hopeful for that. If we get that, then we'll wind up the year 200,000-300,000 off of what we had budgeted as far as a surplus for the year. So we wanted to present that information to you. This is what we were shooting for, was be able to pivot and address the needs of the community during the pandemic and break even, if not better, depending upon FEMA reimbursement.
Okay.
Yeah, Hugh.
Maybe to give you a little bit of ray of sunshine, a piece that Monica didn't add to this is California has what's called the CDAA, or the California Disaster Assistance Act. It's unique compared to virtually every other state in the country, where California has their own kind of like Stafford Act FEMA fund for disasters in California. And what that does is that pays 75% of the 25% that FEMA doesn't pay. So whatever we get out of FEMA, and we will not truly know until, you know, the check comes in the mail, but we're estimating that it will be in that $470,000 range, which is 75% of the total. Well, then California is expected to pay another 18.25% of that. So the actual amount out of the district's reimbursable funds is 6.25%, and not that whole 25%. So that should help your bottom line. And I'm sorry, Hugh Daniels, I'm the managing partner for AskU Emergency Consulting.
That gives us a little cushion, so I am glad. Excellent.
Any more board questions? Tom, is that the end of the presentation, or are we still going?
Yes. So yeah. So this would be the time for any public.
So, any more
comment.
board questions? If not, I guess Mr. Lundy said it's time to be reading the emails that pertain to this topic.
This is Dan Smith, BCHD Communications Manager. There are no public comment emails on this topic.
Okay, so Mr. Lundy, do we wait till we talk about new business and then have the comments, or as we usually do, public comment would go first on this next item?
No, we can move right on to the next item. We can do it item by item.
Okay, but we don't do it before the board discusses and votes.
You could do it before, yes, do it before the actual vote by the board on the item.
Okay, so we can discuss, get public comment, then vote.
That's correct.
Okay, all right.
Yeah.
All right, so I'm moving on now to new business. And we're going to be discussing the potential action item of the approval of the new policy number 5070 for emergency and disaster relief grants, an allocation of $100,000 for disaster and relief grant funding in response to COVID-19 for fiscal year 2019 and 2020. In the packet, there's a memo that talks about this. There's also the exact policy, and there is also the application. Who should we have talk about this, Tom?
Carrie Ann and Jacqueline
Okay.
will discuss that.
Carrie Ann, you wanna?
Absolutely. Good evening again to the board. Carrie Ann Lawson, Chief Programs Officer. What you have before you tonight is our recommendation that the district adopt a specific emergency and disaster relief grant policy. This policy would enable the district to establish a grant allocation outside of our processes for either the micro enrichment grants or the nonprofit grants once we have activated the District Operations Center. So this policy only comes into play when we are responding to a community emergency in which we have activated the Emergency Operation Plan and the District's Operations Center. This would provide our nonprofit agencies and our local jurisdictions, such as the cities, the police departments, and the fire departments, who are providing disaster relief health initiatives with funding that may otherwise not be available to them by other means. These would be awarded to the applicants based on specific operational and recovery objectives and priorities that are determined by the District Operations Center, which means that, you know, this in this instance, we would use this policy for COVID-19. In another instance, given that we're in Southern California, we could be responding to a wildfire, a earthquake, of course, a tsunami, those kinds of things. And therefore, the grants would be specific to whatever the operational and recovery objectives were for that particular emergency. We also are recommending that this be for one-time projects. They're not intended to be an ongoing source of funding, and that it would be granted in an expedited fashion to be responsive to the community need. What that means is right now when the board approves grants, we do it for the nonprofits one time a year tied to the budget process, and it's a performance-based contract that is then active the next fiscal year. These grants are intended to be somewhat immediate, and if you were to approve this grant policy tonight, we would publicize that these grants exist, the application and the criteria and the priorities to the communities immediately, and provide funding to applicants that were reviewed and selected as soon as the end of June. It will be a competitive process and meet all of the requirements of AB 2019. So that we're able to, be transparent with the community about how applicants were selected. We'd have an ad hoc committee. We'd be announcing the awards on our website, and we would be requiring an outcome report similar to what is completed by the microenrichment grant recipients. Again, the difference between the nonprofit grants we were just discussing in the budget is that these would not be performance-based, they would be immediate, and we would receive a report of outcomes afterwards. We would, like I said, we would activate this if you approve it tonight, and we're recommending a grant pool budget of $100,000 from this fiscal year, 2019-2020. And the last thing I'll add is that we did submit this policy to Bob Lundy for review.
And the policy committee has also reviewed this.
Yes, we have. Does any comment? Is that Vanessa?
Yeah, so moved.
Oh, okay, so moved. Is there a second?
Second.
Okay, second by Noel. Vanessa moved, Noel seconded. Now I guess we go on to discussion. So I guess why don't we take public emails at this point in time, please?
All right, again, Dan Smith, BCHD Communications Manager. There are approximately 5 email comments related to this topic. There are 2 from Alan Israel. One came in yesterday, one came in tonight. I'm going to read them together because they're very similar. First one is, please ensure that any grant applications are made public in their entirety. Thank you. And then he amended it this evening, saying, for the sake of transparency, please ensure that any and all grant applications are made public in their entirety. Thank you. And again, that was from Alan Israel. The next comment comes from Sheila Lamb, submitted this evening at 6:27 p.m. To the BCHD Board of Directors. As a member of the public, I support the BCHD board members' efforts to utilize public funds for community benefit where it is needed. However, as board members of a mission-driven public organization, your fundamental question for this initiative is this: what is actually going to change in the community as a result of this funding initiative? How are you going to measure and report community impact as a result of spending public dollars? To become a high-quality, mission-driven organization, BCHD must use best practices such as the following. Then it says, my suggestions. Excuse me one second.
Yeah, my dogs are telling me it's dinner time, so.
My cat was meowing at the door.
They've already been fed. Okay, I'm sorry. Back to Sheila Lamb's comment. Her suggestions. Establish clarity in community need, outcomes, and impact. Report impact using metrics. Measuring output is not equal or synonymous with measuring impact. Define and design your overall impact strategy. Select the metrics you want to use and communicate those metrics with grant applicants. Define data collection processes. Analyze and report community impact to the public using metrics that show change and/or improvement. Improve your grant application document by requiring potential grantees to A, identify community need, and then it says 2, but I believe she means B, identify metrics to be used in setting goals, objectives, service delivery planning, program outcomes, and impact. Utilizing best practices such as these will assist both BCHD and its grantees in making measurable health improvements in the community and ensure that your organizational mission is realized. And then she has transparency in public funding is imperative. Number 1, list the grant committee members on the website. Number 2, list the name of grant applicants on the website. And number 3, require grant applicants to present the request for funding at an open board meeting so that community members are able to view the presentations. Thank you, Sheila W. Lamb. Next, we have one from Brian Wolfson, sent in at 6:43 this evening. It's regarding item number 4.A, discussion and potential action item, approval of new policy number 5070 for emergency and disaster relief grants and allocation of $100,000 for disaster and relief grant funding in response to COVID-19 from fiscal year 2019-2020. BCHD Policy Committee has created a new policy and is recommending that the BCHD board members approve $100,000 grant for dispersal to the beach cities nonprofit or jurisdictional entities within the beach cities. Number 1, the BCHD budget will surely experience a shortfall due to the pandemic lockdown and strains of the new fiscal environment. In fact, the meeting will close in honor of the Center for Health and Fitness employees it's had to furlough or lay off. Number 2, BCHD has itself recently applied for emergency disaster funds from the state and federal government. The question from taxpayers and constituents of the beach cities is, where is the $100,000 grant funds coming from? Is it a pass-through of funding from state and federal or generated from taxpayer dollars? And in this time of crisis, focus on keeping your employees employed. Start at the top and reduce executive and management salaries. Signed, Brian Wolfson. And then the final comment we have was not really assigned to anything. It's from a Vanessa poster, and it says, I'm sending an email to see if this actually works. You may read my email aloud, which is why I'm reading this one. Thanks everyone for your patience. And that's the final comment that's been submitted.
Okay, so let's have a board discussion. Vanessa, you want to go first? You're muted.
Sorry, I think maybe somebody tried to unmute me at the same time as I unmuted me.
Okay.
Are all of our applications for grants public documents or not? What is our policy on that?
Yes, in the past they have been public documents. For this particular grant process, we would be looking to move quickly so that we can provide assistance to people, and so we would not be able to address all of the comments that we heard. We did receive comments from Sheila Lamb as part of the policy committee. And so we have incorporated some of her recommendations into what you're seeing tonight. But this is just an overview of the grants process that is already on our website. And happy to answer any other question. So for instance, we're going in and clicking grants by fiscal year, and so people are able to see what people received.
Michelle, you there? Michelle on the line somewhere?
Yes, I am. I am on the line.
Any comments?
No, I agree. I think that I appreciate all of the comments that we've received and what we received during our policy meeting. I think that these are unprecedented times. We need to pivot quickly. This will be a transparent process as it has been for Beach City. So I am in support of this.
Noel?
I agree with Michelle that, you know, I think that we have a very transparent process, and, you know, if there's an earthquake, I don't think we can drag this out for months. I think we have to have, the purpose of this whole thing is to have a rapid reaction from staff and from the district in a disaster situation. But there is going to be oversight, and, you know, I don't really see it as a problem. And I think staff has incorporated all of the suggestions that are practical.
Vish?
So I actually have some concerns. I guess we're in a time now where the future is very uncertain. There's a concern about future surges potentially. You know, we're at break even, you know, from a budget point of view, but things could get worse as things go on. And so I feel very hesitant to you know, spend money in any way without being very careful about why we're doing it, how it supports our mission, how it supports our longevity. The comments from Brian Wolfson actually resonate with me. We're adjourning in honor of people that are, you know, won't be reassigned. We have to pay attention to our budget going forward, and we don't know how long this crisis continues for. So what I want to understand is a little bit more fidelity on, you know, I understand if we're making a disaster relief grant to a fire department or a police department, what types of nonprofits are included, and is there a way to scope exactly what those nonprofits are doing specific to COVID-19? So if you could share some examples of nonprofits that might fall into this, that would be helpful.
Well, it would need to be a nonprofit that is specifically addressing an operational goal that we have during the emergency. So as you saw in the presentation tonight, we have 6-7 goals or operational objectives. And so they would need to tie directly back to that. So if one of the goals is as it relates to providing assistance to people who are at risk. So if there are meal programs or if there are other things that we can provide funds to, that would be an example. So it'd have to tie directly back to an operational objective. And just to respond for a moment to the comment regarding staffing, we were able to reassign staff as best we could, and we were able to reassign all staff except for staff that would be providing summer programs or staff that did not want to be reassigned. And so we take very seriously commitment to staff. And so we were able to reassign staff that wanted to be reassigned. As it relates to the action that we're asking you to take at the end of the meeting, that was for staff that would normally have been doing a summer program or would be coming on board to do a program that currently isn't happening. So I want to be clear about that.
Yes, all
could somebody else on the board maybe help articulate how this aligns with our mission?
Hi, this is Michelle. I think I can articulate it. When I listened and I had similar questions to yours, Vish, because it wasn't as, you know, $100,000 is, as people say, is 25% of that is taxpayer dollars, or 27%. But then we are a public organization, And, you know, when I looked at this policy in detail along with Jane, and we thought about things like having to ramp up meals to the Salvation Army, getting certain things for the fire department, those kinds of things I think is what makes sense to me, that is mission driven. I think what's changed is that I was always an advocate for having the Beach Cities Health District much more involved in emergency response. We are seeing the tip of the iceberg of what can happen. We could have other things layered upon COVID, the flu, and so on and so forth. So I can't see I only can see it as something that supports our mission, and I can't see it as not supportive of our mission. It's, if it would have been coming to the board and somebody said, you know, we got to put $500,000 out there, I think it would be a whole different discussion. And I think that the transparency and what we're going to be able to have, and have the trust of our organization, our staff, our CEO, to be able to provide the board with the information. I think then at that time, if someone does not believe that something is not mission driven for this public organization that is here to take care of the health of its community, I would, you know, I would say I'm very supportive, and I don't see a problem that doesn't support this mission.
Carrie Ann, do we
Yes.
have a rubric already, or that rubric will be decided by the people on the committee?
So in the application, we are asking folks to respond to the following priorities: testing initiatives for first responders and essential workers, food security, support for older adults and the vulnerable, mental health, and then we included service delivery enhancements to accommodate COVID-19 physical distancing restrictions. So I think our intent is to fortify our nonprofit service delivery system and our local jurisdictions to continue providing the essential services around food security, our older adults and the vulnerable, and mental health through this unprecedented time. So those are the types of priorities that we're asking nonprofits in our jurisdictions to respond to. As for the rubric, we have a rubric that we use for both the micro-enrichment grants and the normal nonprofit grants, for lack of a better term. And we will be using the same type of rubric. And again, it does ask that the grant demonstrates an ability to respond to the priorities and the mission of the district. It also assesses a grantee's or an applicant's ability to generate other types of funds so that we're really helping to fill gaps, and a handful of other things. But we can certainly provide the rubric to the board if you'd like.
I think you also have to kind of put this in perspective a little bit. $100,000 is 1% of the annual budget, a little less actually. So I think giving that level of discretion to staff and the administration is not unreasonable in a disaster.
And then from the budget numbers that we looked at, does this then go negative 100,000 from the break-even number we looked at, or is it?
No, I had already incorporated that as a presentation in the presentation. Okay. It's already included.
That was the last column she had. You asked about the 125. That was the 125. Yes. 25 to Salvation Army, 100 for this grant.
That's correct.
Oh, I see. Okay, got it.
Okay, any other questions? All right, so we have a motion and a second, and all those in favor, please say aye. Aye.
Aye.
Aye.
Aye.
All those opposed? Any abstentions? Hearing none, pass 5-0. Vanessa is requesting a break. So hurry up, Vanessa.
All right, figured out how to change the backgrounds here.
very fancy there. Well,
Just figured that, Noel.
I noticed that.
Yeah, there you go.
You can even put some of your pictures from your drives across Central Asia.
There you go. Not going to be a lot of international travel for a while. I think it's going to be very, very restricted for at least a year.
That wouldn't surprise me.
Well, I think a lot of countries will restrict Americans from traveling into their countries as they
Yeah, that's what I
end up
mean.
in clean zones.
There's going to be all kinds of restrictions all over the place. And if anybody wants to go to another place, if it's going to be quarantined, they won't go. Why go? Mhm.
Here she is. She has returned. So,
Am I really the only person who needed a break?
yes. Here we go. So, discussion and potential action item. Approval of the advocacy letter to the California State Water Control Board in opposition to the extension of the AES Redondo Beach power plant operations beyond the schedule. Retirement date of December 31st, 2020. Somebody want to make a motion?
So moved.
Second? Is there a second out there?
Second.
Noel motioned.
Second.
Second.
Michelle, sorry, Bish. Michelle, second. Okay. Do we want Tom to give some background on this or?
Yeah, Jacqueline, be happy to give
Okay, Jacqueline.
quick update on that.
Sure. Good evening, Jacqueline Sun, Senior Policy Analyst. Before you tonight is an advocacy letter addressed to the California State Water Control Board in opposition to any extension of the Redondo Beach AES plant past its scheduled retirement date of December 31st, 2020. We were asked by the City of Redondo to write a letter in opposition. This is to an amendment of a policy called the Once Through Cooling Policy, or OTC, that was passed in 2010 that called for the phase out of these power plants that use this once through cooling technology, including the Redondo Beach site. Earlier this year, one of the committees recommended an amendment to this policy that would extend the life of the operational life of the Redondo AES plant, as well as 3 other plants, Alamitos, Huntington, and Ormond Beach, citing that they needed to have backup for grid reliability. And so Redondo Beach has asked us to write a letter in opposition, and we would be joined by City of Hermosa Beach, Assemblymember Marisucci, Senator Allen, Supervisor Janice Hahn, in writing similar letters. That they're accepting public comment through May 11th, and their scheduled hearing is for the end of July. Arguments generally in opposition are for the impact of the once through cooling technology on marine life, and as it relates to the health district, the continued health impacts of the operation of power plants due to particulate matter and air pollution that is exacerbated by the density of our community relative to the other power plants that they are discussing. Another argument is that these plants are called peaker plants. They're only operational about 5%, fully operational about 5% of the year. And so the argument is that they may not be necessary for grid reliability for those hot summer months. And the Redondo Beach plant, notably, is one of the least efficient plants in terms of the amount of water that it needs to take from the ocean to do the cooling process. So you'll see the letter is quite general in terms of our opposition and the health impacts. It also notes that the health district was in support of the city's application for Prop 68 funding for the restoration of wetlands and the creation of open green space to the California Natural Resources Agency, and notes that, you know, as a part of public health and as well as physical, that includes physical as well as social and emotional, that we would like to see the creation of green space and open space in that area as quickly as possible. I'm happy to answer any questions.
Okay, seeing no questions, how about we do the public comment if there is some on this item?
No public comments have been submitted on this topic.
Okay, board discussion.
So I'd like to comment. I actually attended the California State Water Control Board meeting. It was a good 5-hour-long meeting, but since it was over Zoom, kind of zoomed in and out as needed. And I made a comment, you know, it was a workshop that they were doing. And I guess my main concern with this is that we have a power plant in a very densely populated area. The population density of Redondo Beach, Hermosa Beach in that area is 4,000% more than the average California population density. And this power plant runs only on hot days. It's a peaker plant. So when it runs, those are the days that we are outdoors the most. So, you know, outside of coronavirus times, those are the days when people are at the beach the most, at parks the most. And I found, you know, 20-something parks within a 2-mile radius, 10, 15 schools within a 2-mile radius, 20,000 people that live right there. And so this is, you know, this plant was supposed to be retired December 31st, 2020. And we had members of Hermosa Beach School Board speak, Hermosa Beach City Council, Redondo Beach City Council, of course, Janice Hahn supported this, Al Murtsuchi, Ben Allen, all of that. It was some sort of randoms that showed up that says they want to extend the plant to run for another 3 years. Steve Aspel was one of those people. I didn't understand what the logic was there necessarily. But I feel like supporting this advocacy letter puts us in alignment with all of the elected officials of our community and also helps preserve the health of our community that is usually outdoors at the time that plant runs. The only concern I have about the letter is we wrote in very general terms. And I remember reading Janice Hahn's letter, and it was very specific to certain data points and health concerns. So I support this letter, you know, wholeheartedly, and I even spent the time to attend that State Water Control Board workshop around this issue. But I think as a health district, we could be a little bit more specific about the data, the real data about the health effects, rather than a generalized statement that affects the health of our community.
Anybody else have any comments?
No.
Okay, well, with that said, Vish, well, this is a resolution that's gonna have to get a 4 to 5 vote. Are you recommending any specific changes to the letter, or what are you thinking?
Yeah, Jacqueline, can you think of what, do you know the letter I'm referring to from Janice Hahn?
I've seen quite a few, but yes, I do.
Yeah, she had a couple of very specific points, and I felt the letter was very impactful.
Okay.
I guess as a health district, I would like our letter to be, you know, as impactful in terms of some specifics. So if there's an easy thing that you can think of to add in, but I don't want to derail the process of this letter. I think the letter is very important. So I'd rather just have the letter as is, or if we can vote to have the letter with some specific data points added to make it more impactful. That would be my recommendation.
I can't vote on something I haven't seen.
Yeah, and there seems like there's a timeline on this one also. We only have a couple of days, so.
Yeah, let's just.
I think if we're going to make a change to the letter, we need to make that change like right now, so that we can vote on it. I'm okay with the letter as is. If we have 4 people that are okay with the letter as is, so I call the question, and let's take a vote. If we have the four votes to do it as is, let's just do it as.
Hearing no more further conversation, all those in favor say aye. Aye.
Aye.
Aye.
All those opposed? Hearing none, passes 5 unanimously, 5-0. Okay, so the next thing is we're going to have discussion and potential action item, approval to authorize the CEO to execute the leasehold property, improvement agreement and the accompanying loan documents for approximately $600,000. The Fourth Amendment lease extension and the estimate $200,000 construction contract for the exterior work for the South Bay Family Health Care 2114 Artesia, a federally qualified health center and district. Anybody want to move? We have a motion.
So moved.
Vanessa moved.
Second.
Michelle seconded it. Okay. Is this Tom's, Leslie's? Who wins this one?
I think
Leslie's
it's
gonna-
Leslie.
Leslie's
Okay,
gonna get
Leslie,
them.
go.
So we have been working with South Bay Family Healthcare for a couple of years. They need to make some improvements to the interior of the building. We own the building on Artesia. We have a long-term lease with them, which is going to expire in the near future. Working with their executives, we hired an architect and designed the improvements, which will allow 2 additional treatment rooms and a pharmacy to be added into their building. The concept is that we would lend them the money necessary to make these improvements. They would pay us back interest at a rate of 5%, and that the payments basically would be paid over the life of a new lease term that would be executed simultaneously with this document. At the same time, we're asking for approval to improve the exterior of the building. Our budget for that work is about $200,000. That work would be funded by Beach Cities directly, but we would enjoy the increase in value from performing that work. The Family Health Clinic Care organization has already, their board has approved in concept this package of materials. The documents have been reviewed by Mr. Lundy's office, and we're ready to proceed if it's acceptable to everyone.
So Leslie, the overage here is like $50,000 more for the exterior, and also their interior improvements are a bit higher. Is that it?
Yeah, the exterior improvements, the interior improvements are estimated total at $600,000. The exterior improvements are estimated at $200,000. So there's $800,000 in funds altogether. However, the $600,000 of funds for the interior will be take place in the form of a loan to the organization, which they will pay back over the term of the extended lease.
No, but we had previously discussed this, and what I'm saying is the overages are incrementally higher than what we had previously discussed. That's why it's coming back, right?
Well,
Yes.
so, I mean, part of the increases like Leslie mentioned is the improvements, right? They are now going to add 2 treatment rooms, a pharmacy. So that's part of the cost increase that we're experiencing at the clinic. The board previously approved $500,000, and per budget resolution, we can transfer the other that is missing from other deferred projects. So we're not adding anything to the capital budget. We're moving it, transferring it from another line item. What we're asking for approval is for Tom to execute, our CEO to execute the contracts that are listed in this action item.
Yeah, because when it went for review with the city, they increased the interior 100 and they increased the exterior like 150 grand or something, right?
You're right, Dr. Chun. We had previously brought forward budgets that were lower and reviewed them with the Properties Committee. That was prior to obtaining the building permits, which are now in hand. But when we went through the the permitting process, there were other requirements that were added, and that resulted in the higher costs.
Right. And then the 600 for the interior improvements are going to be capitalized into a loan at 5%.
Correct.
And what's the payoff period for that?
10 years.
Okay.
Vanessa has a question.
This is a loan, though. They're going to pay it all back, right? This doesn't come out of our budget.
Correct.
The entire
600.
thing is a loan.
The 600 is a loan.
The 600 is a loan. The exterior improvements are not a loan. That's our expense.
So 200 is the district building improvement.
Right.
The 200 is in addition to the 600.
That's correct.
Okay, sorry, I read that wrong the first time. Okay.
Yeah, the 200 is primarily cosmetic improvements to the exterior of the building.
Which increases our property value.
Exactly.
Yeah, that's why we're paying for it. Anybody else have any comments on this, board members? Seeing none, all those in favor, say aye.
Wait, have we
Sorry.
had the public comment? Public comment?
Public.
Oh, I thought we said no. Oh, sorry, that was the other one. Are there any public comments? Sorry.
No public comments have been submitted for this topic.
Okie dokie. So now, board members, all those in favor, say aye.
Aye.
Aye. No. Hearing none, passes 5-0. Okay, we have now got to old business. We have any old business? And it looks like we have gotten to then the adjournment, and we are adjourned. Our adjournment is in honor of all of the health and fitness staff who will not be reassigned on any reassigned on any duties. And obviously we thank them for all of their help. They are what make us so special. And we hope for them to have a great future, or if it works out, they return to us. Okay, is that it, guys? Okay, meeting is now adjourned. Thank you very much.
Thank you.
Thank you.
Thank you.
See you at Zoom in May.
Okay, thank you.
Have a good night.
Good night. Oh, my.